Welcome back, everyone, to the Heart of the Matter podcast. My name is Dr. Najjar, and I'm joined here with some other fantastic doctors. If you want to introduce yourselves.
Yeah, my name is Ankit Hanmandlu. Nice to meet you guys again.
I'm Dr. Peter Kamash, first year internal medicine resident at Detroit Medical Center.
I'm Ramatoulie Darboe, Research Fellow, DMC Cardiovascular Research Unit.
All right, so today we're going to dive into a study from JAMA that could potentially meaningfully shift how we approach lipid management, especially in patients who have heterozygous familial hypercholesterolemia. So, what is heterozygous familial hypercholesterolemia? So, it's a relatively common genetic disorder. It affects about like 1 in 250 individuals, and it's characterized by markedly elevated LDL cholesterol levels from birth due to a genetic predisposition. And because of this lifelong exposure, these patients have a significantly increased risk for premature atherosclerotic cardiovascular disease. And that is why we try to treat them aggressively with guideline-directed lipid-lowering therapy, including high-intensity statins and other lipid-lowering therapies such as Zetia. So, despite using statins and Zetia, a substantial proportion of patients remain above their LDL targets, leaving residual risk. And so that's where PCSK9 inhibitors have given us major advance in this area, enabled us to, produce profound LDL reductions and try to improve cardiovascular outcomes. However, PCSK9 inhibitors are largely limited to injectable formulations, which has impacted, real wild utilization and adherence just because lots of people don't like to use injectables. So it brings us to our trial today. It's called the Coral Reef Heterozygous Familial Hypercholesterolemia trial. It's a phase 3 randomized study and it evaluates Enlicitide, which is a novel oral PCSK9 inhibitors. PCSK9 inhibitors work similar to monoclonal antibodies. They bind to circulating PCSK9, which is just a protease, essentially just it prevents LDL receptors from degrading, which increases the liver's ability to clear LDL. So the prior phase 2 data, it showed LDL reductions up to 60% with a favorable safety profile. And it's just worth noting that Enlicitide is still not clinically available. It's currently under FDA review, but it's looking at a potential approval in the late 2026, early 2027, 2027. So while this isn't a head-to-head comparison with injectable PCSK9 inhibitors, the magnitude that we're seeing with the oral LDL with the injectable LDLs is similar, about 50 to 60%. So we're looking at potential oral therapy that could deliver a similar level of potency with a greater level of convenience. So we'll walk through the design, the efficacy, and the safety data, and what this could mean in the future as we look at intensifying our lipid lowering therapy moving forward. So let's get into it. I'll introduce Dr. Hanmandlu.
Hey guys, so I'm going to quickly touch on the methods of this study. So first, I'll start with the patient population. So anyone over the age of 18 that had an established diagnosis, either genetically or followed some sort of local clinical diagnostic algorithm for heterozygous familial hypercholesterolemia. At screening, the patients either had a major ASCVD event and had an LDL level of 55 or greater, and those that did not have an ASCVD event were required to have an LDL of 70 or greater to be eligible to be even enrolled in the trial. All patients generally were on a moderate to high intensity statin with some other additional anti-lipidemic therapies as well. Some key exclusion criteria, obviously, they couldn't have had recent treatment with an injectable PCSK9 inhibitor, and they did not have the diagnosis of homozygous familial hypercholesterolemia. In summary, this was a phase 3 double-blinded, placebo-controlled, parallel group randomized controlled trial that was conducted between August 2023 to April 2025 at actually 59 sites across 17 countries. So widespread trial enrollment, widespread patient population. Quickly to touch on this, so the patients were randomized in a 2-to-1 ratio to receive 20 milligrams of enlicitide versus placebo, once daily for 52 weeks. And an important thing just to mention about the administration of the medication. They were actually instructed to take it once daily on an empty stomach in the morning and not to consume any food or beverages other than water until 30 minutes after dosing. So something to, evaluate the absorption. So they didn't want anything to confound any of the results. So with that said, I'll leave it to Peter to talk about the results.
Thanks, Ankit. So when discussing the results, I want to go over two parts. One, I want to talk about the efficacy of the study and the safety of the study. In terms of the efficacy of the study, the primary outcome of this study was to assess LDL levels at 24 weeks after Enlicitide treatment. So what the study showed that there was a decrease of 58% in the Enlicitide group with an average reduction of 70 milligrams per deciliter. This is notably remarkable because when you look at the placebo group at 24 weeks, there was no change in terms of their LDL cholesterol. Looking at secondary outcomes, one point that we wanted to look at was moving the study from 24 weeks to 52 weeks. And it showed a similar trend. Those on the Enlicitide ended up dropping their LDL cholesterol by about 55% with an average drop of 64 milligrams per deciliter. Notably, when you look at the placebo group, they actually had an increase in their LDL cholesterol by 52 weeks by around a 9% with an average increase of 8 milligrams per deciliter. Other outcomes that the study looked at was looking at the non-HDL cholesterol at 24 weeks. Those in the Enlicitide group ended up dropping their non-HDL cholesterol by 50% during that time span, comparing to a negligible difference in those in the placebo group. Another aspect that they looked at was looking at the apolipoprotein B levels at 24 weeks. Again, the Enlicitide group ended up dropping those levels by about 50% with negligible change in the placebo group. And even lipoprotein A was studied, and at 24 weeks, they found out that the Enlicitide group dropped those levels by 25% compared to a negligible change in the placebo group. And all this being said, one really important aspect that the study also wanted to look at was just to see how did Enlicitide end up allowing participants to meet curing guidelines. So they wanted to see what percentage of participants in either group were able to reduce their LDL cholesterol level by over 50% and have a total LDL cholesterol under 70 milligrams per deciliter. They found out that those in the Enlicitide group, 71% were able to achieve that compared to only 1% in the placebo. And when we look at even dropping it even further to 55 milligrams per deciliter, 67% and those in the Enlicitide group were able to achieve that compared to only 1% in the placebo. Now I'd like to transition to the safety aspect of the study. When you're comparing the proportions of participants in either group that had at least one adverse event, the proportions were relatively similar. About 78% in the Enlicitide group ended up having one, at least one. And when you look at the placebo group, it was 76%. When you look at those adverse events and interpret them, most of them were mild in nature. And when looking at the frequency of having a severe adverse event, it was relatively similar in both groups. 4.5% of those in the Enlicitide group ended up having a severe adverse event compared to only 4.0% in the placebo group. And even when you look at those serious adverse events, the investigator didn't even feel comfortable even attributing it to the treatment at hand. And with that said, I'd like to go to Dr. Darboe.
Thank you, Peter. So this study provides strong evidence that Enlicitide, an oral PCSK9 inhibitor, is both effective and well tolerated among adults with heterozygous familial hypercholesterolemia. And this patient normally present with markedly elevated LDL cholesterol and 13-fold increased risks for atherosclerotic cardiovascular event compared to the general population. Therefore, the most striking finding in the study is the magnitude of LDL cholesterol reduction that Enlicitide has achieved, which is approximately 58%, and a significant reduction in other atherogenic lipid parameters, including the known HDL cholesterol and the apolipoprotein B. And what makes this study particularly important is the route of administration. Unlike unlike the monoclonal antibody PCSK9 inhibitors, which require injection, Enlicitide is taken orally, which makes it more convenient and potentially improving patient adherence and overall lipid control. And in terms of safety, just like Peter has mentioned, Enlicitide demonstrated a favorable profile. The incidence of adverse effect was similar to that of the placebo group, suggesting that the drug was well tolerated. And this is especially important for a therapy that is likely to be used chronically. And from a clinical perspective, this drug has the potential to fill important gaps in lipid management or lipid therapy. It could serve as an alternative for patients who cannot tolerate statins, those who do not or are unable to achieve adequate LDL cholesterol reduction, or unwilling to use injectable therapy. And these are some of the beautiful things about this agent. However, there are some limitations to the study which are worth considering. And the first one is the study duration. Although the study has it has produced sufficient time to assess the lipid-lowering efficacy of this medication, it does not provide long-term cardiovascular outcome data. And while LDL reduction is a strong surrogate marker, we still need evidence showing that Enlicitide reduces cardiovascular events such as myocardial infarction and stroke. And another important point is while the trial include multiple centers across different countries, the real-world adherence and the effectiveness may differ from the control clinical settings. And therefore, in conclusion, Enlicitide really represents a promising advancement in lipid-lowering therapy. Its oral formulation rather, combined with potent LDL lowering effects or therapy and good tolerability really puts it in a position where it can be potentially transformative option for management of heterozygous familial hypercholesterolemia. That's all from me for now. I'll hand it over to the gentleman.
Thanks so much, Dr. Darboe. I think you were very thorough and you hit all the right points. It's an exciting period. Hopefully we'll get like another agent approved for us and an oral formulation to try and control those people with more resistant elevated LDL levels. If anybody else in the group has anything else that they want to add.
Yeah, I think in the spirit of like the hyperlipidemia guidelines being released, I think this is a good study to review. This patient population obviously reflects a very high ASCVD burden or a very high risk AVC burden. So we could use this as a surrogate for other patients that are eligible for this as well. Those have had prior MIs or prior strokes and whatnot. I'm excited to see what the long-term efficacy data is. I expect it will be similar to other anti-lipidemics that have been tested, but it's good to know that we have an oral option to hit multiple different lipid markers, lipid or lipoprotein A, lipoprotein B, and then LDL. The last thing I will say, although this is oral medication, it's taken daily, and other PCSK9 formulations can be given, like biweekly or monthly or even like longer duration. So it's another option for patients to use, as we said, that who do not want to take injectables, but that's also the dosing schedule is also something we should keep in mind. But that's all that I have.
Yeah. And I'm just really looking forward to just seeing as PCSK9 inhibitor research coming out, just seeing the long-term impacts of them, and even seeing an oral versus an injection, seeing if there's any really difference between them. With that all said, thank you guys all for joining us in our podcast. If you guys have any comments, please feel free to leave them below, and we'll see you in the next episode.
Thanks, guys, for joining us.
Thank you.